A patient receiving hemodialysis reports a sudden metallic taste in their mouth. The PCT should first: A. Stop the blood pump immediately. B. Notify the nurse at once. C. Ask the patient to rate the taste on a pain scale. D. Lower the ultrafiltration rate. Answer: B. A metallic taste can signal dialyzer reaction or impending hypotension. The nurse must evaluate immediately to prevent worsening symptoms. Stopping pumps without clinical confirmation may cause complications, while symptom rating or UF changes delay urgent assessment. A PCT observes that a patient's fistula has a faint thrill compared to previous sessions. The best action is to: A. Document thrill present only. B. Elevate the patient's arm. C. Report decreased thrill to the nurse immediately. D. Flush the access with saline. Answer: C. A decreased thrill suggests potential clot formation or access failure. Prompt reporting prevents loss of access. Documentation alone delays intervention. Elevation has no value, and PCTs cannot flush access sites. While assisting with a wound dressing change, the PCT notices a sudden foul odor and green drainage. The next step is: A. Continue the dressing change. B. Apply double gloves. C. Notify the nurse of the abnormal findings. D. Cover with extra gauze. Answer: C. Green drainage and odor indicate infection and require nursing assessment. Continuing or adding gauze risks worsening the infection. PPE changes protect the PCT but do not address the underlying clinical concern. Before transferring a stroke patient with unilateral weakness, the PCT should: A. Place the weaker side closest to the bed. B. Position the stronger side closest to transfer surface. C. Use a wheelchair without locks. D. Avoid using gait belts on hemiplegic patients. Answer: B. Positioning the strong side toward the transfer surface maximizes safety and mobility. Weaker side transfers increase fall risk. Wheelchairs must always be locked, and gait belts are essential, not avoided. A patient's oxygen saturation drops from 97% to 89% during ambulation therapy. The PCT should: A. Increase oxygen flow. B. Sit the patient down immediately. C. Encourage deeper breathing first. D. Continue ambulation slowly. Answer: B. A sudden drop below 90% is unsafe. Stopping activity and sitting the patient prevents collapse and restores oxygenation. The PCT cannot adjust oxygen flow. Coaching breathing without stopping is risky. A patient on fluid restriction asks for an additional cup of ice chips. The PCT should: A. Provide half a cup. B. Allow chips because they melt slowly. C. Explain it counts as fluid and must follow restrictions. D. Give sugar-free ice instead. Answer: C. Ice chips melt into liquid and count toward total fluid intake. Allowing more violates orders. Substituting sugar-free items does not change fluid volume. A PCT is performing post-mortem care and notices the patient still has a Foley catheter. The correct action is: A. Notify the nurse for removal instructions. B. Clamp the Foley and leave it in place. C. Remove the Foley as part of care. D. Empty and discard the bag only. Answer: A. PCTs follow facility policy. Some require Foley removal by an RN. Improper removal may cause urethral damage. Clamping or discarding does not meet procedural requirements. A patient receiving blood pressure monitoring shows repeated narrow pulse pressures. The PCT should: A. Inflate cuff higher each time. B. Document and take no further action. C. Report changes to the nurse immediately. D. Switch arms and try again. Answer: C. A narrowing pulse pressure can signal shock or cardiac failure and requires rapid nursing assessment. Repeated attempts without reporting delay urgent care. A patient with a chest tube complains of increasing shortness of breath. The PCT sees no bubbling in the water seal chamber. The priority is: A. Notify the nurse immediately. B. Clamp the chest tube. C. Refill water seal to top line. D. Ask the patient to cough. Answer: A. Absent bubbling plus dyspnea may indicate tube blockage. Only clinical staff can fix or replace the tube. Clamping can cause tension pneumothorax. A patient becomes suddenly anxious and restless during dialysis. The PCT's best response is: A. Reassure the patient and continue. B. Ask about emotional stress. C. Notify the nurse because this may be early hypotension. D. Lower the blood pump speed. Answer: C. Restlessness often precedes hypotension or severe hemodynamic instability. Immediate clinical evaluation is required. Slowing the pump or reassurance alone is unsafe. During catheter care, the PCT notices the urine has become cloudy with white strings. The action is: A. Increase patient hydration. B. Report abnormal findings promptly. C. Irrigate the catheter with saline. D. Replace the drainage bag. Answer: B. Cloudy urine indicates possible infection or blockage, requiring nursing assessment. PCTs cannot irrigate catheters. Hydration changes require orders. A confused patient repeatedly attempts to remove their foreline. The PCT should: A. Apply restraints immediately. B. Provide closer observation and notify the nurse. C. Cover the fore with thick blankets. D. Allow the patient to move freely. Answer: B. Increased monitoring and nurse notification ensure safety while avoiding unauthorized restraints. Covering or ignoring the problem risks device removal and bleeding. A patient complains of dizziness after standing. The PCT measures BP 98/60 sitting 74/50 seconds standing. The best action is: A. Continue standing assessment. B. Document findings only. C. Offer juice. D. Help the patient lie down immediately. Answer: D. A sharp BP drop is orthostatic hypotension requiring immediate return to a safe position to prevent syncope. Juice does not treat the cause. Documentation without intervention is unsafe. A PCT notes a patient's respirations are irregular with periods of apnea. The name for this pattern is: A. Byat's respirations. B. Shane-Stokes. C. Kussmaul. D. Agonal breathing. Answer: B. Shane-Stokes shows rhythmic cycles with apnea, common in severe illness. Byat's is irregular but without crescendo-decrescendo. Kussmaul is deep and rapid. Agonal occurs near death. A patient receiving enteral feeding begins coughing violently. The first action is: A. Stop the feeding. B. Increase the flow rate. C. Give water via tube. D. Reposition to supine. Answer: A. Coughing during feeding suggests aspiration risk. Feeding must be stopped immediately before additional formula enters the airway. Supine positioning worsens aspiration risk. A stroke patient with dysphagia is coughing after sips of water. The PCT should A. Encourage more fluids. B. Report symptoms and stop oral intake. C. Give thicker liquids. D. Keep water only. Answer B. Coughing after thin liquids indicates possible aspiration. PCTs cannot modify diet independently. Stopping intake and reporting ensures safe swallow assessment. A patient's heart rate rises from 88 to 138 during routine vitals. The PCT should A. Repeat manually. B. Ask about emotional stress. C. Report immediately due to possible arrhythmia. D. Continue vitals normally. Answer C. Sudden tachycardia may signal distress, arrhythmia, or internal bleeding. Immediate reporting is essential. Verification delays treatment in unstable cases. During perineal care, the PCT notices new skin tears. The next action is A. Apply ointment. B. Report findings immediately. C. Cover with tissue and continue. D. Ignore if patient has fragile skin. Answer B. Skin tears require clinical evaluation to prevent infection. PCTs cannot apply ointments without orders. Ignoring tears is unsafe. A patient states, "I feel like I might faint." The PCT should first A. Take blood pressure. B. Have patient sit or lie down immediately. C. Offer juice. D. Call security. Answer B. Preventing injury from falls is the priority. Vitals can be taken once patient is safe. Juice may not address underlying cause. A PCT notices a patient's 4-pump alarming occlusion. The correct action is A. Silence alarm and continue. B. Attempt to flush 4. C. Check for patient arm bending and report to nurse. D. Replace 4 tubing. Answer C. Occlusions often occur from arm positioning. PCTs cannot flush or replace sterile 4 equipment. Nurse must evaluate if repositioning fails. A dialysis patient complains of severe cramping in both legs. The PCT should A. Notify nurse because cramping suggests excessive fluid removal. B. Ask patient to stretch. C. Increase ultrafiltration. D. Tighten blood pressure cuff. Answer A. Leg cramps during dialysis indicate too rapid fluid removal. Only nurses can adjust UF. Stretching offers no meaningful correction. A patient with a tracheostomy has increasing secretions bubbling at the opening. The PCT must A. Deep suction the trach. B. Increase humidification. C. Notify nurse for potential suctioning needs. D. Cover opening tightly with gauze. Answer C. PCTs observe and report. Trach suctioning requires proper credentials. Blocking the opening obstructs breathing. A PCT notes a patient's capillary refill is greater than 3 seconds. This finding indicates A. Good circulation. B. Potential poor perfusion. C. High blood glucose. D. Increased oxygenation. Answer B. Slow refill suggests circulatory compromise requiring nurse assessment. It does not signify glucose or oxygen changes. A patient's glucose reading is 45 mg per deciliter and they are awake but shaky. The PCT should A. Give insulin. B. Recheck glucose after 30 minutes. C. Call dietary. D. Provide fast-acting carbs per protocol. Answer D. Symptomatic hypoglycemia requires immediate carbohydrates according to facility protocol. Insulin would worsen their condition, and waiting is dangerous. A PCT observes a patient clutching their chest and sweating. The priority is A. Offer water. B. Call for nurse immediately. C. Take full vitals before acting. D. Massage the chest. Answer B. These are classic acute cardiac symptoms requiring immediate medical evaluation. Taking long vitals wastes life-saving time. While weighing a dialysis patient, the PCT notices a 3.5 kg loss since the previous treatment. The next action is A. Report weight immediately. B. Reprogram machine. C. Encourage the patient to drink water. D. Ignore changes. Answer A. Excessive weight loss suggests dehydration or high UF. Only clinical staff can decide adjustments. A patient receiving oxygen by nasal cannula shows persistent mouth breathing. The PCT should A. Tape the mouth. B. Encourage nasal breathing and notify nurse. C. Increase oxygen flow. D. Switch to mask independently. Answer B. Mouth breathing reduces oxygen delivery efficiency. PCTs cannot change devices or flow without orders. A resident suddenly becomes confused and disoriented. The PCT's best first step is A. Assume dementia. B. Assess for safety and notify nurse. C. Restrain immediately. D. Tell them to calm down. Answer B. Sudden confusion may indicate infection, hypoxia, or stroke. Safety checks and reporting ensure immediate medical intervention. A patient with new PICC line dressing shows blood seeping at the edge. The PCT should A. Reinforce dressing lightly and notify nurse. B. Remove dressing completely. C. Ignore unless dripping. D. Add tape tightly. Answer A. Reinforcement prevents contamination while allowing nurse assessment. Full removal risks dislodging sterile line. A patient with COPD is using accessory muscles to breathe. The PCT should A. Lay patient flat. B. Report respiratory distress immediately. C. Give bronchodilator. D. Encourage breath holding. Answer B. Accessory muscle use signals severe respiratory compromise. Only clinical staff can administer medications or adjust treatment. A patient reports a sudden severe headache during blood pressure monitoring. The PCT should A. Finish the reading. B. Notify the nurse immediately. C. Offer water. D. Change cuff size. Answer B. Sudden severe headaches can indicate hypertensive crisis. Continuing vitals delays life-saving intervention. A PCT observes a draining pressure injury with SLU. The correct response is A. Clean thoroughly with strong pressure. B. Keep wound open to air. C. Notify nurse because SLU requires clinical debridement decisions. D. Apply tape to keep edges together. Answer C. SLU signals deeper tissue damage requiring proper evaluation. Strong cleaning can worsen the wound. A patient has a condom catheter that repeatedly detaches. The PCT should A. Use tighter adhesive. B. Check sizing and skin dryness before reapplying. C. Strap it tightly. D. Switch to Foley. Answer B. Proper sizing and dry skin ensure device adherence. Tight adhesives risk skin tears. Foley insertion requires RN order. A patient receiving continuous tube feeding has a distended abdomen. The PCT should A. Pause feeding and notify nurse. B. Increase the feeding rate. C. Administer anti-gas medication. D. Lower HOB. Answer A. Distension can signal feeding intolerance or obstruction. Feeding must be paused and evaluated clinically. A PCT notices a patient's heart monitor shows irregular patterns. The next step is A. Ignore because PCTs don't interpret. B. Immediately notify nurse. C. Turn off monitor. D. Adjust electrodes without reporting. Answer B. Sudden rhythm changes require urgent clinical review. Even if PCTs cannot diagnose, reporting is mandatory. A patient with ESRD becomes pale and nauseous during dialysis. The PCT should A. Continue treatment. B. Sit patient upright. C. Offer candy. D. Report symptoms, may signal hypotension. Answer D. Nausea and pallor often precede hypotension and require nurse assessment. Upright positioning may worsen instability. A PCT finds a patient's urinary drainage bag lying above bladder level. The action is A. Leave it if half full. B. Empty bag first. C. Clamp tubing. D. Lower bag immediately. Answer D. Drainage bags must remain below bladder level to prevent backflow and infection. Clamping or emptying does not fix positioning. A patient vomits bright red blood. The PCT should A. Give water. B. Assist to upright position and call nurse stat. C. Clean and ignore. D. Offer crackers. Answer B. Hematemesis suggests internal bleeding requiring emergency evaluation. Upright posture protects airway and calling nurse ensures rapid intervention. A patient complains that their telo leads itch severely. The PCT should A. Remove all leads. B. Apply lotion. C. Ignore unless bleeding. D. Replace electrodes and assess skin. Answer D. Skin irritation requires assessment and new electrodes. Lotion interferes with conductivity. A PCT notices a pressure cuff on a limb with a dialysis graft. The next step. A. Leave it unless painful. B. Remove and report immediately. C. Move it closer to graft. D. Inflate gently. Answer B. No pressure device should be used on graft limbs due to risk of thrombosis. Immediate removal prevents damage. A patient refuses a scheduled blood glucose check. The PCT should A. Force the check. B. Give juice instead. C. Skip without documentation. D. Document refusal and report to nurse. Answer D. Patients have rights to refuse. Proper documentation and reporting ensure safety without violating autonomy. A patient on strict fall precautions attempts to go to the bathroom unassisted. The PCT should A. Scold the patient. B. Stay with patient and provide assistance. C. Lock room door. D. Turn off call light. Answer B. Assist and supervise immediately to prevent falls. Scolding or restricting access violates patient rights. A patient's telemetry battery is critically low. the PCT should A. Ignore if leads still connected. B. Remove leads until nurse returns. C. Turn monitor off. D. Replace battery and confirm signal. Answer D. Maintaining continuous monitoring is crucial. Replacing battery ensures rhythm visibility. During cane training, the PCT sees the patient holding cane on their weak side. The correction is A. Keep cane on weak side. B. Hold cane on strong side. C. Remove cane. D. Walk faster. Answer B. Cane always goes on strong side to support weak limb. Incorrect positioning increases fall risk. After repositioning, the PCT notices a reddened area that does not blanch. This indicates A. Stage 1 pressure injury. B. Normal pressure response. C. Allergic rash. D. Moisture irritation. Answer D. Non-blanchable redness is early tissue injury and must be reported for prevention of further breakdown. A patient suddenly develops slurred speech. The PCT should A. Ask them to drink water. B. Suspect stroke and notify nurse immediately. C. Wait and recheck in 1 hour. D. Have them lie flat. Answer B. Slurred speech is a classic stroke symptom requiring immediate action. Delays worsen outcomes. A PCT finds a patient with blood pooling under a surgical dressing. The next step: A. Remove dressing. B. Ignore unless saturated. C. Tighten with tape. D. Reinforce and notify nurse. Answer D. Reinforcement protects wound while nurse evaluates for hemorrhage. Removing dressing breaks sterility. During intake, the PCT measures a respiratory rate of 6 breaths/min. The action is A. Recheck in 15 minutes. B. Report immediately respiratory depression. C. Ask patient to breathe faster. D. Ignore if patient awake. Answer B. 6 breaths/min is critically low and may indicate opioid effects or neurological decline. Immediate action required. A patient with heart failure reports sudden ankle swelling. The PCT should A. Give water. B. Ignore unless painful. C. Wrap ankles tightly. D. Elevate legs and notify nurse. Answer D. Swelling suggests fluid overload. Elevation helps temporarily, nurse must reassess to adjust treatment. A patient complains of new numbness in their left arm. The PCT should A. Massage arm vigorously. B. Report immediately for neurological evaluation. C. Tighten blood pressure cuff. D. Ignore unless painful. Answer B. New numbness may indicate stroke, nerve compression, or circulation issues. Immediate reporting ensures timely intervention.